There you go. Folks, my first guest tonight is a neurosurgeon, a best-selling author, and CNN's chief medical correspondent. Please welcome, for his first Stephen Colbert interview, Dr. Sanjay Gupta. Thank you, Doctor. Good to see you. Won't you please?
Thank you.
Thank you so much for being on here tonight.
Thanks for having me. I wish it were under, better circumstances. But
Me too.
Appreciate it.
But you know, if a good time to talk to Dr. Sanjay Gupta. You're informing a lot of people over on CNN. I see you talking with Anderson many nights.
Yeah.
And you're a doctor, and you have a new podcast.
Yep.
Called
Coronavirus: Fact versus Fiction.
Okay, let's get into some of the fact versus fiction tonight. You talk on the podcast about the line between caution and panic. And that's certainly something we've talked a lot about here, about, like, say, when to get rid of audiences, or, how to do the show maybe without the staff in the building, so we try to keep people as safe as we can. Where is that line? Because that line seems to be kind of blurry right now.
Yeah, and I think it feels different for different people, and it changes. It's changed a lot over the last 2 months. We've been covering this story in great detail for some time. People now, I think more than ever, are really starting to pay attention. I don't think it ever should cross into panic, because panic doesn't serve any purposes, I think, certainly from a medical standpoint. The medical establishment is having to prepare here. But I think the idea that people should be concerned enough to really start to do things with their own lives that can help protect them, I think is real. I mean, that's within all of us at this point.
Well, let me rephrase it slightly then. How worried should we be?
I think for the majority of people, this is not going to be something that's going to make them tremendously ill, this coronavirus. It might make them sick for a few days, though likely to recover.
And how does that manifest itself? Because I've heard that, for 80% of the people, and correct my numbers here if you need to, the 80% of the people, you'll have nothing or something mild.
Right.
In it to manifest. But the 20%, it could be severe, approximately. What is that severity? When it does manifest itself, what is that?
Yeah, so people will develop a pretty significant pneumonia. A lot of times they'll develop inflammation in their lungs. You think of the lungs as sort of being these soft sponges.
Yeah.
When you start to get that inflammation, the sponges become harder. They don't work as well, so it becomes harder to breathe. Initially, someone might just have difficulty walking up a flight of stairs without getting short of breath where it was no problem before.
I say running once around the audience and then coming on stage.
Exactly.
Panting.
That's right. But you'll notice changes in terms of how your body's functioning, but ultimately it'll get to...
What if you're in your mid-50s and you're noticing changes in how your body functions all the time?
You're in good shape.
Thank you.
You're in good shape.
That's a doctor.
I could tell, yes.
That's a doctor. A doctor just said I'm in good shape, honey.
There's certain population of people I worry about. I'll tell you, Stephen, I've been calling my parents every day. They're in their late 70s. They live in Florida. And it really struck me in the beginning of this conversation, the message was always 80% will be fine. Mm-hmm. And I was thinking, well, what if I'm in my late 70s or early 80s and you're hearing nobody cares about me? Mm-hmm. And so we have identified who the vulnerable population is here. It is elderly people. It is people who have some pre-existing conditions like heart disease. For them, their immune system won't be able to fight this virus as well. So the lungs won't be able to stay as pliable, and eventually they can develop what's called a respiratory distress, and they need to be on a breathing machine. They need to be supported while the body tries to fight off the virus. That's happening. It's happening in real time. Right now, as I'm talking to you, in Italy, in Korea, in China, patients showing up at hospitals, sometimes these hospitals not having enough to take care of these patients. And I'm just stunned by the decision-making that has to happen at these hospitals right now. I have a patient here, I have a patient here. Both of them, I could save them, both. But I don't have the resources to do that, so I'm gonna have to make a really tough decision. That's what's happening here. Is that alarming? Yes, it should be alarming. Can it be prevented? Absolutely. Should we have been preparing for the last 6 weeks? For sure. Did we? Doesn't seem like it. That's, I think, if I get panicked, it's not because of the virus, it's because of our response, I think, thus far to things.
I hear conflicting stories or reports of how this can spread. How does it spread as far as we know? Is it surfaces? Is it droplets? Does it aerosolize? How long can it stay on the surface? Do we know?
We do have a pretty good idea now. China was the first place we really started to see this, and there was these large studies of 70 or 80,000 people, and they started to really look at that. It doesn't seem to aerosolize like you think of measles, for example. With measles, the little viruses will attach to dust, and they'll literally suspend in the air. If I had measles and I left here 2 hours later, someone could come in here and actually contract the measles from where I was sitting.
And that's not happening.
That's not the case here. So respiratory droplets, the virus is in these droplets. When people cough or they sneeze, those droplets can hang in the air for a little bit, but typically they'll go to ground or go to a surface or something like that. So if I'm in close proximity, within 3 to 6 feet, something like this, yes, exactly. It's more concerning, but the surfaces is because those respiratory droplets can land on a surface. You touch the surface, you touch your eyes, your nose, or your mouth, and that's how people become infected.
Should people still date? I mean, because
I think it depends how much you like the person.
Yeah, but I mean,
everything is a
blind date.
No, no blind dates.
Tinder?
Definitely not. Definitely. But even before this, no Tinder. I'm kidding. Here's the thing. I think, Stephen, everything in life is a risk-reward proposition. I tell people all the time, as a doctor, don't smoke, don't eat cheeseburgers and things like that. Yeah. But if you really want one, you'll do it because the risk-reward proposition is good enough for you. Getting on a plane, I'm getting on a plane tomorrow probably. There's certain, is it riskier to do things versus before? Perhaps. But everything's a risk-reward proposition. Being in close contact with somebody, especially somebody you don't know, it's a different time right now. And I think what I'm really struck by is that never before, and I've been doing this for a long time, have I found a situation where how I behave so dramatically impacts your health, and how you behave so dramatically impacts my health and all the people in this theater tonight.
And what I keep thinking of, it's not just you, but my behavior towards you is going to affect your parents in their late 70s.
That's right.
I'm seeing the people that you know.
That's right. These concentric circles around you, and that has to be important to me. I have an obligation now, not just for my health, my family's health, but for your health and your family's health. We are codependent on each other in a way that I've never seen before. There's an obligation now. I don't want to get too philosophical here, but I find it really fascinating in a way that if not for me, if I don't engage in these good behaviors for me, then I should do it for you. I should do it for the people around me. And I think hopefully that's motivating for people to do this. I think that individual behaviors make such a big difference here. I don't think people get it yet, but I think people will get this, Stephen. I really do, because it's so important for people to understand. I tell people to wash their hands, and then you're telling me in the middle of a pandemic that washing my hands, that's all you've got? I'm like, do you understand how much of an impact that not only makes for you, that makes for me? It's becoming very real, I think, for people in that way.
Well, we don't have an audience, but we still have commercials. We have to take a little bit of a break. Please stick around. We'll have more information about coronavirus and how you can protect yourself and your family from Dr. Sanjay Gupta. Stick around.